Hi everyone, it's Heather. Just wanted to give a quick update. It is about halfway through my first semester of respiratory therapy school and things are going pretty well. Um, haven't had any big problems with any of my classes. I actually am starting pharmacology next week. That's a shortened course. It's just kind of an introduction to some of the drugs that we're going to be using. So that starts in 1 week from today. And we're also having a little celebration for Respiratory Care Week next week, 1 week from today. I guess in hospitals they do various things, whether it's free food or training or celebrations, or some places really don't do much at all. But we are just having a kind of potluck get together with the in-house students and the distant students, so we can kind of get to know each other. So yeah, classes have been going well. Been learning a lot. It's been really interesting. Haven't had any big problems with anything. There's been a lot of memorization, but I think the key for me is making sure that I understand the concepts to the point where I can explain them to other people if I need to. And I feel like if I can do that, I know that I really do understand the material. I did really well on midterms. We only had midterms for 2 classes because I have one class that's online and it doesn't have any, it has 6 tests, but none of them are considered like a midterm. They're not cumulative tests. So I have 2 lecture classes and 2 labs for in person. And the labs, of course, have lab protocol check off things that we have to do periodically, but nothing that's like a midterm. So I just had the 2 midterms in my 2 lecture classes and did really well on those. I got a few wrong on one of them, but then some of the questions were tossed out because they were kind of critical thinking questions that were a little bit difficult, a little bit above the kind of conceptual thinking that we had been doing in class. And so she said that if a fair number of students in the class got them wrong, that they wouldn't count against us, but I got most of those correct. So I actually ended up getting like 103% on the midterm because I managed to get most of those correct. So the other ones that I missed, ended up not counting against me all that much. So, and then the other one, I got 100% on that. It actually was a pretty easy test, I thought. I do so many flashcards, and I am lucky enough that I don't have small children and I don't have a job outside of school, so I am really, really lucky in that I can spend a lot of time making flashcards and going through my flashcards and making certain that I absolutely understand everything. And I do have a study group that I meet with, and that helps as well because I feel like we can kind of discuss things and make sure that we all understand the material from various viewpoints and from various not understandings, but you know what I mean? How some people explain something one way and you may not understand it, and then something gets explained a different way, and then all of a sudden you go, oh, yeah, I understand that now. So I feel like having the study group has been really helpful, and I have a great study group, some really nice people. So classes are going really well. Pharmacology upcoming, I'm a little bit nervous about. It's just going to be a lot more memorization, I think, and again, making certain that I understand how certain drugs work the way they do. I'm certain that's going to be part of it. So, but yeah, things are going pretty good. Clinicals start in about 3 months. I have my clinical group picked out. We're supposed to have 3 or 4 students that we're going to be going to clinicals with. So I have my clinical group, and I'm really excited. A great group of people from my lab section as well as other people that I'd known from another class that I took previously, as well as a someone that I've just come to know this semester. So that's really great. I think we're going to have a really good time at clinicals, and we're all really hard workers, and we're going to make certain that we learn a lot and help each other. So that's pretty much it. That's all that's going on. I haven't gotten scrubs or anything like that yet, but when I do, I will certainly be putting some information up here on what I like and don't like about the scrubs that I end up getting. We're starting with breath sounds. We just are starting to listen to breath sounds this week. And I think that that's going to be challenging because certainly some breath sounds sound very similar to others. So we've just been given some recordings to listen to at this point, but I do think that that's going to be challenging. We've been told that our breath sounds checkoff is going to be one of the more challenging ones for the semester. So, and after that, I think we do ABGs. So that will be interesting too. I don't know if I'm excited to learn that or more trepidatious about ABGs. For anyone who doesn't know, if you are looking into respiratory therapy, you do have to draw blood on people. So respiratory therapists pull ABGs, which are arterial blood gas. So you typically are drawing blood from the radial artery in the wrist. There are other places that you can do it if you can't, for some reason, get a radial artery. But if you're looking at respiratory therapy in part because you don't want to have to draw blood as a nurse or start IVs or something like that, be warned, you still have to deal with needles and drawing blood. So, and in fact, ABGs are supposed to be more painful than a regular venous blood draw. So, definitely a skill that you want to master and cause as little pain to your patients as possible. So that will come at the very end of this semester for us. So that's it. Pretty much just wanted to give you an update and hoping to hear how everyone else is doing. Anyone else who's commented previously, or if you're watching this video and you're a student, leave a comment down below. Let me know how school is going for you. Bye.